Good morning and welcome. Thank you for being here today. Today is April 27th, 2026, and we are here in the Commissioners' Conference Room at our Administrative Services Building in Fort Collins. We're here for a work session for our quarterly update on our progress for the 2024 through 2028 strategic plan, and we are very excited to hear an update from our presenter here in just a moment. I am Larimer County Commissioner Jody Shattuck McNally, Chair of the Board of County Commissioners, and I welcome you again to this work session. Joining me at the conference table is Commissioner John Gonfalez and Commissioner Kristen Stevens. Also joining us is our County Manager, Lorinda Volker, and we have other folks in the room that I'll have our Director of Performance, Budget, and Strategy, Josh Fudge, introduce as we have this presentation. So let's proceed, and Josh, I'm going to turn this over to you now. Thank you.
Thank you, Commissioner. Once again, my name is Josh Fudge. I'm the Director of Performance, Budget, and Strategy for Larimer County. And today we'll just be walking through the updates this past quarter on progress towards the 2024-28 strategic plan, as you mentioned. This time we're going to go in the usual order, goal 1 through 4. There is one new bullet point since I sent you the presentation on Friday. That's on page 4. Goal 2, objective 2, and we'll talk about that a little bit, just to update today. So goal 1, resilient, equitable, and engaged community, communicating with the public. This is still ongoing. The website, it has been substantially completed by the team with this branding information and the successes and deliverables from the prior strategic plans as well. And they are currently working on an agreement to provide video for that website. So hopefully we will have an update and perhaps a demo of some website or video at our next update. And sorry, I think when I mentioned the new bullet, I said goal 2, but it's actually goal 1, objective 2B, which you see here. So objective 2A under this is to improve engagement with the community through a single platform, and that sub-objective has not yet been started. And then sub-objective 2B is evaluating legacy systems to ensure compliance with accessibility laws. They are seeking to implement their new software to make documents accessible. As of now, they will ask for strategic plan funding when they take that software to the IT steering committee, I believe. It's one of many tools that will be available in Absorb as well. The foundation's training has been created and will be released shortly, and that's along with the software that will be in Absorb as well. The new bullet that you see here at the bottom, it's underlined because it's new. Mackenzie Lowe is going to present today. She's the sub-objective team lead here, but unfortunately she's feeling ill today. But she did let me know that the federal Title II digital compliance due date has been extended out to April of 2027. So we have some time and some additional time to comply with that. That's the update for objective 2. Any questions on that?
Colleagues, any questions? Commissioner Gonfalez, I see your hand is raised.
Thank you, Josh. Just to go back to the previous slide, can you remind us the video? What is the theme or the focus of that video? What is its purpose?
So there will be just short videos showing what has been achieved through the prior and current strategic plans, video stories, just to provide a little more context and information, some of the successes. So we had previously done videos similar to this, I think, in the first version of the strategic plan that ended in 2018. There weren't any in the prior version, so we're going to try to create some that provide a little more information.
Thank you kindly, sir. Thank you, Madam Chair.
Mr. Stevens, did you have any questions? I didn't have any. Thank you, Josh.
Okay. So for objective 3, maximizing partner relationships, 3A is one currently active sub-objective, and the team is actually kind of looking on a path forward. Initially, this was really going to focus on the NOCO Foundation's report, the gaps. I forget what the name of the report was, but they were looking at service gaps in some key areas like housing, economic development, childcare, things like that. They have really, in the interim, focused more on workforce housing, which we will certainly continue to be involved in. However, the prior plan of this objective team, really relied on the larger piece of that report, and so they're going to try to maybe refocus as we go forward. They are going to participate when the Office of Emergency Management does the update to the county's resilience framework. So how they'll participate in creating that is to be determined, but at the last meeting, a couple of staff from Office of Emergency Management walked through the prior versions of that resiliency framework. It hasn't been updated in quite a while, and so this could be a good process for this objective team to help with. The remaining sub-objectives you see below, for the most part, are completed. Connecting the local nonprofit sector and the county to align on legislative priorities. Training and information for the nonprofit sector has been created, so that is complete. Increasing data sharing and coordination with partners in law enforcement. Our LINK project is operational, which really helps the county and local law enforcement partners to share really key data. And so that sub-objective is basically completed, or that part of it. Also, the SIM mapping is occurring in Goal 1, Objective 1. I'm sorry, that should be Goal 2, Objective 1. So this sub-objective is completed and operationalized. 3D was expanding the co-response model, and unfortunately that sub-objective, that co-response model, is no longer active. Same with enhancing public awareness of the co-response model. 3F, increasing awareness of the Behavioral Health Impact Fund. Really, behavioral health now has started to operationalize this as they, kind of continue on with the normal cadence of the Behavioral Health Impact Fund, and so that is complete and operationalized. And then finally, 3G, which is implementing the multi-year funding initiative. As you may remember, behavioral health engaged in an effort to provide multi-year grants through the Impact Fund, and so that process is mostly complete, and now behavioral health is working on implementing that. And so this sub-objective is complete as well. Any questions on Objective 3?
Commissioner Stevens, I see your hand is raised.
Thank you, Madam Chair. So with serving as a regional convener, were you saying that because the NOCO Foundation is only focusing on workforce housing, that we're not going to, can you explain that more?
I think they've changed direction. So you might recall NOCO Foundation published the Intersections Report for Larimer and Weld County, and they were building a lot of their work around that report, but then NOCO Foundation has shifted toward a housing focus. In fact, they've got a workshop coming up on that. So the group is regrouping around what does that look like now if there's not a foundational report to base it on. Maybe there are other ways to go forward. So it's not stopping, it's just shifting gears a bit.
But there's still work we can be doing in this regional, even if it were just focused on housing, right? And I know Aaliyah had talked to us a little bit about being a convener regionally for housing and some opportunities with the HUD consortium and things like that.
Exactly,
So,
yes.
So there's other ways that we can pivot from this. It's just, their report won't be as comprehensive. Is that why we're not going to
Basically.
rely on that as much?
They're
Okay.
regrouping and regrounding on what does it look like. When you're grounding on a document and community work that's being done, it's easy to go forward. When you have to kind of regroup, housing is an easy one, but there are probably others. We're doing it with the Climate Smart and Future Ready program. There are a lot of places we're already acting in this way. The question is, how do we best expand it? And what's the county's role to bring people together?
Thank you.
Great question, thank you.
I have some more questions on that. So, we've been doing work in housing and working with partners, and we have some strategies, and we've done a lot of analysis. So I'm trying to understand why we're waiting for NOCO Foundation and have their report, and I'm trying to understand why that's it almost sounds like it's leading, the work and not us. And I'm wondering how does that fit? And is it a partnership? And then when you start talking about that we're regrouping Climate Smart something, we're talking about the county, not NOCO Foundation. I think I'm feeling like that's getting a little murky.
You're right.
I'm just curious.
This goal came up, the county is a convener and a good partner, and so that's how this goal emerged. Right about the same time, NOCO Foundation was working on their Intersections report. So this group said, why don't we use that and build on that in places where we might expand how we do this work in convening. So it wasn't driven by, it was let's build on something that another organization has worked on.
or maybe collaborate and amplify or work together, is that? And then my other question, and I don't know, did you have something, I didn't know if your hand was
I
raised.
see our objective leader is here, so maybe she would answer these differently.
So, but the climate smart and some of the behavioral health that's separate. That's not part of the new sector report. It's just the NOCO Foundation is housing.
Correct. Those were examples of ways that we convene already, and we have become a kind of a trusted partner to convene groups. We don't drive our own goals. We really are open to what other people have to say, and that, I think, is what makes us a trusted convener. Those were just examples of what we're already doing.
Awesome. And there is some new efforts, especially when it comes to Loveland and nonprofits, looking at other ways to work on housing insecurity and housing stability. And those are new on the horizon that I've learned about. I'm wondering, how do we, if they're a nonprofit that's starting to gain traction and has an innovative new model, how do we show interest or engage just to maybe see if there's maybe a new pathway that hadn't been there before with some of the changes happening in the southern part of the county?
Do you want to talk about that related to the objective?
We're, excuse me, good morning, Lori Cadridge. I'm the Assistant County Manager, and in this case, the objective leader for this goal. So if I could just start by providing the context for what our goals team has looked at. We looked at regional convener, and we early on figured we should list the kinds of things that we're being a regional convener in that maybe need more stories told to the community, following up on our community strategy session and what people said to us. And that's how the co-responder program got on there in behavioral health, and most of those have cascaded to be operational or are no longer working the way they were. But one of the big things that we looked at was the intersections report, because it covered the entire county as well as Weld County, and it covered several categories that need regional work. And in it, what the NOCO Foundation was intending to do was look at each one of the categories, identify what best practices were happening in that category. So it could be like affordable housing or mental health stability or transportation. Identify what best practices were happening and then identify where the gaps were. So our goals team early on thought, well, we could pick up some of the gaps that might be in one of those categories. Because housing has become such a huge issue for the community, both in Larimer and Weld counties, NOCO Foundation has focused more attention on the housing segment and then further identified workforce housing as an area of interest. And so the work that we thought we were going to be able to pick up from those other categories, or even that category, isn't going to happen the way we thought. Doesn't mean we can't plug in on other things that are happening in the county. You might remember, this is the group that identified, boy, maybe nonprofit organizations could use some help with legislative issues and organizing. We went out and did that training, and now that has cascaded where the nonprofits are doing it themselves. So that's off our plate as well. So if you do have areas of interest that we're not always already leading in, we're happy to take a look at that. But we're regrouping to see where we might be able to fill a niche on this one.
That's helpful. Thank you. Commissioner Gonzalez?
Thank you. Thanks, Lori. And I think by and large, you probably answered my questions, but I'm wondering, could you list the areas that we internally view ourselves as regional conveners, and how and does that align with how the community sees us? So, for example, you mentioned a number of things like housing, et cetera, behavioral health. I'm wondering, through our water master plan, are we viewed, is that a regional convener role that we have, helping to oversee some of the efforts around water quality, water storage, resiliency as it relates to drought and everything else?
I'm not sure I would see us as a regional convener in water as
Okay.
much as the NOCO Foundation is on behalf of that Water Alliance team. It doesn't mean we couldn't be for some other reasons. We identified early on the co-responder program because the Sheriff's Department was leading efforts regionally, statewide, and nationally, so that we looked at that. Climate Smart and Future Ready, the behavioral health work. There's probably others as well that just, Office of Emergency Management came on our list as well. There's probably others. But water, I'm not sure yet what our role's going to be in that, because there's things that are still being evaluated in that.
No, I appreciate that. And just as a quick follow-up, and then we can certainly move on, it seems to me that it would be in everyone's interest to be more sure about what our role is in some of these big-ticket items, whether it's transportation or water. And you referenced the Northern Colorado Water Alliance, and I know they've expanded I recall that they've expanded their purpose, because initially it was just municipal, and certainly the water issues are much more than just the needs of municipal needs. So I wonder, what are your thoughts on that, as far as if we're not convening that, and I'm okay with that, then who is
Yeah, for the Water Alliance,
the Water Alliance?
what we pay for dues allows the NOCO Foundation to be the convener and serve in that convener role. So they hire a consultant that brings us all together, and that group is probably 60 strong now, 60 different agencies. And that's why I would hesitate on having another party convene a separate group, because there are at least double the number of agencies participating from when I first started on that group.
Yeah, and I'm not suggesting that. I just want to have a better understanding of the lay of the land and who is viewed as regional convener and who's doing the work and what is the county's role, whether we're taking the lead or we're part of an alliance or a coalition. Thank you.
You're welcome. Any other questions, Commissioner? Anything you'd like to add, Rhonda?
I would just, I would say that the county takes the lead in a lot of ways that are invisible to people. So the Community Health Improvement Plan is another good example of the county convening community members to identify important issues. We're not real good at telling that story, that we do this important convening work just by nature. It seems like it's what we do at the county. The transportation folks get together. In this case, the Water Literate Leaders class is something that we've all participated in, but it is led by NOCO Foundation for years. They've sort of managed that as a water leader. So we want to make sure we don't step on anyone else's toes who's doing a great job doing that work, but find the gaps where we can serve a different role. Air quality is another one I think that the health department's really worked on. And our community development department has acquired that grant to help us cap and seal those 50 wells in the county. So there's a lot of good work being done just quietly behind the scenes. We should probably get an inventory and be able to talk about it.
Well, thank you, and hopefully through our videos and our communication strategies, our proper role in all of these areas, which are big areas, complex areas, will become more visible, so folks know that the county is indeed engaged and does contribute to making meaningful differences in people's lives and families and all the rest. Thanks.
Thank you. Let's proceed forward. Thank you.
Thank you, Lori, for explaining that far better than I did. So with Goal 2, Quality of Life, the first objective really combines two sub-objectives, 1A and 1B, promoting health and well-being for our community. The UC Health recently held their public meeting on April 15th for their Community Health Improvement Programs update. There are three focus areas: access to care, behavioral health services, and chronic conditions. The slides and PDF overview are available should you want to see it. And then the Health District continues to work with Red Feather Lakes residents to do a convenience sample survey to assess healthcare access among area residents. That pilot started on April 17th with Mountain Ministries, and the official kickoff was held at the North 40 Food Pantry this past Friday, the 24th. And so I will turn it over to Joe Buckley to provide any additional information.
Welcome.
All right, there we go. Thank you so much. Yeah. My name's Joe Buckley, and then I'm the Community Health Improvement Plan Coordinator. Thank you for the shout out of that program earlier. I'd be happy to answer any questions about these, but I will just add to what Josh shared, that for UC Health, they do this work on a continual basis of their community health improvement plan, or they just call it the community health plan, and we add the word improvement at our county level version of it. But essentially, they always have these programs ongoing, like Healthy Harbors, which supports youth under 18. They have the Medicaid Accountable Care Collective, which is for family level care and adults, and then just other ways that they're meeting the social determinants of health. So these programs are making sure that people have housing, are signed up for Medicaid, have access to healthy food choices, can learn about preventative health screenings in places like their community center, their school. So we get to work with them a lot, and this is nice to hear that their plan is recommitting to these 3 areas of focus, because us at the county are focused on those as well right now in a variety of ways. And then separately, the other update on the health district, I know as Commissioner Kafalis, you're deeply involved with this too and representing that area of our county. And I actually wasn't there on Friday. I'm always at our Cafe Connection that we do at Red Feather, but what I've heard so far is that it was a great kind of kickoff of it and a way to really talk with community members and make sure that we're hearing their stories and sampling what sometimes can be too low of a population to hear from in other surveys. So yeah, if any questions, please let me know, but otherwise it's great to be here.
Thank you. Commissioner Kafalis.
Thank you, Joe Buckley. I have one question, and then in the spirit of shout-outs, I have a couple of shout-outs. My question is, can you tell us more about the Connections Cafe and how that interfaces with the North 40 Mountain Alliance, resiliency up there, safety net and community building with the food pantry and all the rest?
Absolutely. Yeah, thank you. I think this fits well with the theme of today of how we were talking about county conveners. So this started because actually Krista Timmerman from CSU Extension had been a leader in the area for a while. Joanne Herkenhoff from UC Health, so Aspen Club related work, and then myself at the Larimer County Department of Health and Environment. Us 3 collaborated on starting it. And the goal really was to support social connection in an area where folks might have been most isolated. And we saw, especially coming out of COVID, that folks that live in that part of our county can be more isolated because of older adults not having kind of work and other outlets that some other people in town might, because of the geographical distance and because of some basic needs needing met of gas or food, healthcare, et cetera, that can limit from social connection. So we're so grateful to work with the North 40 Mountain Alliance, which runs a food pantry every Friday, and we decided to kind of build on success there. And folks were attending the food pantry, but waiting in their car for their turn, or, we're all there at the same place, but didn't have the interaction always. Yet there's these seeds of an incredible volunteer team that were really closely tight-knit and knew each other and were building those great connections and would take food to people's houses. So we decided to build on that with just bringing up coffee, bringing up our tent, bringing up other resources, and each month we make sure to come with that kind of like fun, come have a cup of coffee with us, but also a resource. So it's connecting with each other and connecting with a resource. Last month, our resource was the health district and the survey, but prior to that, we've done scam prevention or fall prevention, stroke screenings, and like high blood pressure screenings, connections to mental health services or veteran services. So yeah, we are up there all the time, thanks to these gracious hosts that we have, and it's so nice that the minister of the church where it's held, if there's cold weather, he just invites us all upstairs, and then we really hang out drinking coffee together. So, yeah, it's definitely one of the favorite parts of my job, and a great way that we get to kind of do that convening work, because if I don't know about a resource, maybe someone from UC Health does, or vice versa.
And then my quick shout outs. One is a shout out to the Health District of Larimer County. Allison Williams and some of their policy and research team they've been very instrumental in working with the folks up at the Red Feather Lakes area. And as was mentioned, the convenience sample survey was highlighted on Friday, but it also went out on Friday the 24th, and I think that survey is live till May 31st. The shout out is to the Health District and their team. They've been very helpful. Another shout out is to Michelle Bird, our Public Affairs Director. She sent out an email on Saturday that went to folks on our Red Feather Lakes, Crystal Lakes email list, as well as people in the Livermore area. There are 3 zip codes that we're trying to capture to get more information to help inform the need for any kind of primary care clinic or health center up there. So thanks to Michelle for doing that, and I guess I better stop there. Can you tell us how people can access the survey? I could, but
Yeah, I think the best way would be to connect with, for folks local to Red Feather, I think Annie Scott is your best connection through Mountain Ministries and also through the Health District.
so there is
Both
a
those
flyer and
folks
there's a
are-
QR code, and
And I know there's one in the library, but I think they can find one at Church of the Pines. But yeah,
Yeah.
if you know of other spots, I think that is a great
okay.
piece to advertise.
Enough
Yeah,
said. Thank you.
great. Thank you.
Thank you, Joe. Let's keep going, Josh.
So for Goal 2, Sub-Objective 1C, that's developing the sequential intercept model. And for that, I will turn it over to Emily Humphrey.
Good morning. Again, I'm Emily Humphrey, and I'm the Service Area Director for Community Justice Alternatives. I just wanted to give you an update on where we are with the sequential intercept mapping project. I know you've all had a presentation from us with the final report out, but we really wanted to figure out what comes next, and we didn't want the report to just sit there and gather dust. So we reconvened our planning group and assessed the report out. And originally, there was 4 priority areas and 7 opportunities and recommendations given by the folks that came and presented that workshop to us. And so what we did was we got our small group together. We had Michelle Bird facilitate that so that we could have some structure. And we decided to focus on 3 different areas and create buckets that we could actually work on from that 90-page report out. So what we're going to do first is, I'll talk about the 3 buckets in just a second, but we had the original workshop that had about 70 individuals, and there were some agencies that we couldn't have present because we just didn't have enough room. So our next goal is to have a webinar and have everyone from the original workshop, as well as other folks that weren't part of the original workshop, to look over the report and the buckets that we've created. And from that webinar, we're going to take those 3 buckets and have committees and invite individuals who are experts in those specific buckets to really have action plans and start moving forward and giving them the opportunity to go forth and conquer and do where they have their expertise and really make a difference. And so I did want to talk just a little bit about the bucket areas, the 3 bucket areas. The first one we have is our crisis systems, and we have a priority statement to strengthen the community division and crisis system by renovating our mobile crisis response, expanding access to care, especially in high acuity outpatient services and specialized training. So that's one bucket. The second bucket is cross-organizational collaborations, and we want to identify organizations committed to spanning boundaries. And what that is spanning boundaries is kind of like a patient navigator where someone enters a system and you follow them all the way through. Why can we not do that with behavioral health and criminal justice? So again, identifying committed organizations for spanning boundaries and collaborating across the areas where behavioral health and criminal justice intersect. These partners will develop shared and formalized workflows, resources to strengthen communication, expand shared expertise, increase system awareness, and eliminate silos. So that's bucket number 2. And probably the most robust bucket we have is community systems and structures. And that's going to encompass a lot of different areas, but partner with key community systems like housing and transportation. Because without housing and transportation, the barriers continue for folks who are justice involved that have behavioral health issues. So we want to ensure that people at risk of criminal justice involvement can access and stay engaged with behavioral health services, even going to appointments, so they don't miss their appointments, so they can stay on their medications, as an example. We want to work with these systems to increase community understanding of stigma and boundaries to care, helping people feel safe, of belonging, and supporting their ability to thrive through education, connection, and stability. So we have incredible partners, and we're hopefully going to be able to narrow it down who goes into bucket 1, bucket 2, and bucket 3, and then really give them the ability to create their own subcommittee and really move forward with trying to have maybe some low-hanging fruit, but then some big projects that we can work on.
Emily, is there a way, you just read some amazing information and I couldn't write quick enough. Is there a way you can share what you just stated, all those notes with us? That would be.
Absolutely. We have a PowerPoint that's going for the webinar, and I'll just take those out and send them to you.
That would be great.
Absolutely.
I don't think I have any other questions. Colleagues, do you have any questions? Okay, thank you, Emily.
You bet.
Thank you. So objective 2 under goal 2 is supporting an opportunity economy. The first one being that specifically that opportunity economy. So if you remember, they've been working on the P card, utilizing that to help promote small local businesses. And so for this section, I will turn it over to Kelsey Bond from Economic and Workforce Development.
Hello, everyone. Kelsey Bond, Economic and Workforce Development. A couple exciting updates in this area. Last session rolled out the example of the P-Card landing page that has all the resources and services we had developed. And that is officially getting pushed starting May 1 in our internal communication that's getting sent out by Jen Glover, spotlighting what Power the P-Card is, how to access that training on Absorb, as well as how to access this P-Card landing page that has kind of the robust resources and educations we've provided. This is also coming with in Absorb for folks that do complete that 18-minute education in a 6-question quiz. There's a Nectar challenge that we've associated with that. So really excited that we have that support from the Strategic Committee to really elevate that. So it is accessible to every employee at the county, as it truly is an education, while we recognize that not every employee does have a P card, but hoping that it can uplift and empower folks to understand the impact of their purchases. Additionally, we are working on a vendor list. It has been approved and is in the queue at ITSC, so excited for when that comes up. That vendor list is, again, specifically focused on food and beverage. It is pulling from public data sources of food and beverage organizations in our county. So every business should be available on that. And we additionally are working with some folks in performance to support the creation of what we're calling a purchasing analysis strategy. This is not new, hopefully, to you all. We have created a template for it. And once that vendor list goes live, though, we are creating a sustainable way that teams, departments, us county as a whole are going to be able to really easily pull and understand our spending patterns as well. So excited for that to come out. Again, making sure we're building it right the first time for long-term sustainability of the effort. So vendor lists, as well as the purchasing analysis tool, will be coming hopefully by the next presentation and quarterly session we have. And part of that, too, is we are wanting to make sure that we are seeking to build goals behind our opportunity economy, so that we're not just saying we're doing it, but we're really having that accountability and driving towards positive action as well. So that's 2A. Any questions?
Commissioner Stevens, I see your hand is raised.
Yeah, thank you, Madam Chair. This is really great. Really excited about this because I think that sometimes it's I will say that sometimes I understand the ease of using somebody who's not a local vendor. So are we working with the local vendors at all, like saying, how can you make this easier? I mean, are we working with them on their end to show them like kind of what would be easier? What is your, because I mean, sometimes for folks who have to order food for like a big group coming into the county, I mean, that's, they have a lot of things on their list. And so how can we work with them to make their process easier?
Yeah, thank you, Commissioner. So yes, and I think it's important to acknowledge that we also want to reinforce that all business is good business, right? From our major national corporations to our local businesses, all are really supporting the well-being of our community. And specifically with a lot of our smaller businesses, a future action that we have, we're calling an anchor institution, how to do business with an anchor institution. And we've started the early groundwork of that by even surveying folks here at Larimer County and at City of Fort Collins to understand what informs purchasing behaviors, of which being able to order online or ensure that there is delivery or being able to have a quick turnaround are things that were really elevated behind those behaviors. So our goal in creating that how to do business with an anchor institution is to be able to give businesses, specifically our smaller and local business community, best practices and resources of how to make it more effective and efficient. Yeah.
That's great. Thank you.
Commissioner, any questions? Yeah, this is exciting, and I've been trying to do what I can. I'm actually online or phone today with a local vendor for one of my community conversations.
Nice.
And
Wonderful.
it's a new up-and-coming business, and trying to. One thing I think is it always makes them freeze is how do they do tax exempt status or not.
Yep.
And I think that's one thing that it seems like that's a common theme. It
Yeah.
like makes them freeze.
Yep.
When it maybe isn't. It's pretty not simple, but it's not as hard as maybe folks think. So I was wondering also with us, you're talking with these local businesses, but how could you also help maybe us as commissioners or other folks? I don't know, cheat sheet or something that's maybe simple to help, in case I'm out, this is tax exempt or something, then
Yeah.
it's something I can help show us. It helps that the numbers are bigger on the cards and things, but also how can we, or some common comments to help make it not so, because I almost feel like you can almost see the panic on their face, like,
Yeah.
because I don't know how to do that. So I'm curious about that.
Yeah, thank you, Commissioner. So with that, how to do business training, definitely seek to couple it with resources. So like you said, to those one-pagers that can just get passed off to businesses, also identifying some folks in Larimer County, almost a train the trainer model. So who are those champions that are really well-versed in that content that we create that can then be those point persons and people for businesses to reach up with follow-up questions. So yeah, thank you for that. Absolutely important.
I appreciate that. And I figure it was, but it's, I still think this is an amazing push, and I can't wait to see. We'll have some more data and some more information. I can't wait to see how that progresses. Colleagues, any other questions or anything you'd like to add, Lorinda, on this? Because this is, I think when some people are like, I don't know if it's the city or someone else said, well, this county should be trying to do this. And I'm like, we already are. And they were like, what? I mean, they were surprised that we had already been, for over a year, I think, been pushing this. So it's been exciting to say, like you said, we don't toot our horn or don't say some of these things. And I think some folks were pleasantly surprised and maybe thinking maybe we're leading the way in this a little bit.
It was interesting when we had this conversation with the leadership team because we think of it as our choice to purchase, but we're not the ones in that room who make the purchase. It's the people typically at our front desks and who arrange for the meetings and those kind of things. So when this group talked to them, we realized the reason they gravitate toward these bigger companies is because they have online menus and they have online ordering. So that's part of the doing business with an anchor institution is not just telling them how to process a tax exempt purchase, but also these are the kind of barriers we have because they are in a hurry and we do need to be efficient, but we also want to be local. And so for those that are willing to take the class and to participate, they'll hear some of that and maybe some will be able to make that accommodation. so that it's easier for our front desks to reach out to them and make that order. So it really is a hands-on, experiential kind of a thing from both sides. It's very a respectful process, and I think you all have done a great job engaging the community and the Downtown Development Authority and the Chamber and all the folks that coordinate these small businesses who we'd love to purchase from.
Wonderful, I appreciate you adding that. And the first thought that popped in my head was, okay, that sounds like we got a nice connection in Fort Collins and the downtown, but I'm wondering about other businesses in Estes Park, Berthoud. Well, I mean, how are we connecting with some of those chambers or some of those local businesses?
Yeah, absolutely. So with the creation of that anchor institution training, definitely need to be thoughtful and appropriate representation throughout our entire region for feedback and kind of co-creation with our business community. And we have done a good job of even establishing some of the goals and vision statements of really touching and building off of existing initiatives, commissions, and more to really get in front of them for feedback. With the actual Power the P Card education training, we're hoping now that we have that original content, we can do a roadshow is one of the kind of sub goals that we have layered in here. So once we have from the person side, the purchaser side, and then the training from the business side, doing an intentional strategy for roadshow across our entire region. Yeah.
Fantastic. Well done. Great work.
Thank you.
I'm super excited. Without any other questions, I think we're ready to proceed. Thank you so much.
Yep. And you get more from me, so keep going.
Oh, well, I'm glad you're sticking around. This is great.
So the second component of the opportunity economy is really focused on the care workforce. And speaking to what we heard a little bit earlier, we have taken a really intentional pause to slow down and align with efforts that are already existing. And so when thinking of the care economy and specifically the care workforce, the committee has spent some time to better understand what efforts are happening within care. So we think about direct care occupations, healthcare occupations, and more. So we've done initial phases of asset mapping. I'm going to do an intentional outline of that. But that has really led us to align with other efforts in almost doing a marketing campaign to really elevate some of these great resources for folks that work in the care economy. An example is at the state level, HCPF, they actually have something called directcarecareers.com. So it's state of Colorado, and I think 3 other states have this as well. And that is a job platform as well as training platform, and they have certificates that they couple with that. And so we had folks from that department within the state come and present to our workforce staff and leadership a couple weeks ago to better understand what that job platform is. They have said they are going to be sharing benchmark data with us so we can specifically track from both the business side and the job seeker side of who's using that platform, and then be able to, once we start doing a marketing push around that, have those numbers that we can keep checking back in to see if our efforts are supporting driving both workforce and driving businesses to post their care occupations in that state vetted space. So that's an example of one of the ways that we really want to align with efforts that are already going and the experts that are doing the work, and really leverage our resource in supporting, again, both the business side and the job seeker side in our county. Another example would be understanding what is happening with 1B, and so having that really thoughtful relationship with NoCo Kids Thrive, formerly Larimer County Early Childhood Council, and working with our internal human services staff. And we, again, are intentionally ensuring that we're aligning with the actions and efforts that are already occurring within our own county team. And so we, both this objective team as well as economic and workforce development, are continuing to have those conversations and learnings so that we can be ready to press go as soon as that opportunity arises. Lastly, there is a state House Bill 231196. It's the Opportunity Now Regional Action Committee House Bill. We, Larimer County, are part of the Northeast Tactical Region. I have the opportunity to be that objective leader for the Northeast region, which includes Larimer, Weld, and actually 4 of our rural consortium regions as well. But one of the 3 industries that's focused in that state House Bill for us is healthcare. And in that tactical plan, there is various components around supporting healthcare workers and growing and supporting specifically nursing and MAs. So we're also then aligning with that existing effort so that we can then support from that marketing strategy as well as hiring fair strategy to reinforce and support that House bill effort.
Any questions? Commissioner Kafalis?
Thank you, Madam Chair. Thank you, Kelsey. So does your work, does your work also include, as far as developing this care workforce, helping people to navigate overcoming barriers to participating in the care workforce, since regardless of our efforts, it still tends to pay salaries and wages that make it hard to live in the community. Housing, childcare, the usual suspects. The main barriers to meaningfully engage in the workforce. Can you speak to that a little bit, Kelsey?
Yeah,
please?
thanks, Commissioner. And I think there's multiple answers for that. So specifically within this county strategic goal, the committee has also really identified language and language access as a key component. And so there's another effort that has been completed of creating a language access resource guide that is available to all county employees. So it's just one piece I want to name. For economic and workforce development, we also, and when thinking of some of these specific occupations, really are identifying occupations that are quality jobs or lead to quality jobs. So thinking of those pathways to truly grow into livable wage, quality benefits. The state of Colorado has a definition of what a quality job is, knowing that it is multifaceted beyond just salary. So the focus specifically within that tactical plan with the House bill is those occupations that can grow into quality, livable jobs here in Larimer County. And we also, I would say the county we have staff that are really plugged in with childcare, housing, and transportation, knowing that those are key barriers to employment. That is a big focus of NOCO Works, as well as just our economic and workforce development team. We have folks that are really plugged in from NOCO Foundation housing efforts to NOCO Kids Thrives to NFRMPO. So the learning and the pulse of what's happening in those barriers to employment, we are on to specifically this, I would say, objective. The internal team has not identified the barriers as a key focus of the work right now. So it's a yes and. Yeah,
Yeah, thank you.
of course.
Do you have any questions, Commissioner? So I had a question. Been talking a lot of healthcare recently. When you talk about this Northeast Regional Technical Workforce Plan, a couple of questions. First, how are we partnering or communicating or connecting with those institutions, healthcare institutions, whether they be some of our community health centers or hospital systems like UC Health, to how is that all connected with that effort?
Yes, absolutely. So I appreciate you asking that. For the regional tactical plan, the Northeast region is unique in the state that we have anchored our efforts to the sector partnerships. So that means the health sector partnership, which I believe has over 80 organizations plugged in. They are really the ones leading the work. Workforce development boards are tasked with reporting for this House bill. And in lieu of the workforce boards being the doers, we think it's really important that the industry partners are the doers. So we have a strategy of they were able to vet all the goals that are in that tactical plan, and we have built a way that we are having feedback loops with those sector partnerships as well as regular touch points for data collection so that we're able to ensure that the goals are also aligning with what industry is needing.
And my next question to build off of that is, when I saw Northeast region, that made me think of the RETAC I'm on this State Emergency Medical and Trauma Advisory Council Services. And that is our first responders, our ambulance services, and those caregivers who are also transporting or connecting to those systems. And that's also a very critical workforce need, and also might be really important for folks who access to care when the minutes count. So, and it's called RETAC, Northeast Regional, I forgot, but there are several of those, and I'm wondering if that overlays with RETAC, because I know it's several, it's kind of Larimer, Weld, and I kind of think it goes a little bit to the northeast. Do you know if EMS and paramedics or EMTs and that is also part of this kind of collaboration and part of that consortium? Is that part of those conversations? Those
Yeah.
are really important, first responders and workforce needed in those rural communities when minutes count.
Yep. I would love to learn more, and if you have any literature and connections in that, would love to learn more of it. Knowing that we do have some of our larger healthcare systems on the health sector partnerships, such as a UC Health and a Banner and a Kaiser, are in those spaces. My assumption is they are representing those occupations as well. To my knowledge, I'm not familiar with the plan that you named, so would love to learn more and make sure there's alignment.
Yeah, I'm going to respectfully ask if you can ping me with an email, because I have a lot
Yeah.
of things juggling today. And then I will connect you with some of the leaders of that and that structure, and wondering if there's a possibility to connect, because that also is important for folks to get in times of emergency, but also they might be able to do, my hope is maybe innovatively, if they're out there, they might be able to do at least some, I don't know, get folks resources, and I think that's happening, but I wonder if there's a missing connection there. So if you wouldn't just mind, if that's all right, if she just copies, I would love to try to connect you with that. And I have someone who lives here locally but serves regionally that maybe, and also works for UC Health on the ambulance, that I think would be a good resource for you. So
Wonderful. Thank
great.
you.
Thank you. Any other questions? Awesome. Thank you so much.
Thank you, Kelsey. The final objective under quality of life is to improve housing stability. The first sub-objective is inventorying and defining best practices for reentry for justice-involved residents. And as in previous updates, this team is awaiting the work of Goal 2, sub-objective 1C, about this sequential intercept mapping. So as that continues to go, then this team will pick up on some of those efforts or gaps as are identified. For 3B, participating in the Homeward Alliance strategic plan to address homelessness. That strategic plan has been completed. There is now an implementation committee made up of members across the housing network. And so that group will kind of take on implementation of this plan. And so for purposes of the strategic plan, this sub-objective is considered operationalized and complete. And then also 3C, coordinating regionally on land use. The Housing Resource Guide has been completed, and some of the other work by the Climate Smart Future Ready program. So this sub-objective is complete as well. Any other questions on Objective 3?
Commissioner Stevens, I see your hand is raised.
Yeah, I just want to, for the public that's listening, just because we have things that are complete doesn't mean we're done doing the work on housing. So I just want to make sure that people understand that these are just, pieces of the puzzle that we're trying to put together to really make sure that we are working on housing. Housing reentry for justice-involved residents is really an important piece, and these are folks that really struggle with finding housing. They have turned their lives around and still, hard coming out of those, whether it's community corrections or other facilities, and really finding housing. So I'm glad we're focusing on that piece. That's really important. But the housing work does continue, and we will keep plugging along on that. Thank you.
Commissioner, that's a really important point. So we use the word operationalized intentionally. So sometimes it's a report that is one and done and it's complete. But the housing effort is operationalized. And so that is one where I hope the public does hear We've gotten the thing off the ground. And now we're working on what we learned with that objective. So thank you for that. That's true in many of these cases. When we say operationalize, we mean it's become a thing that we do now.
Thank you. That's an important point to make. Any other questions, comments? Okay, let's keep rolling, Josh. Thank you.
So goal 3 is related to the natural and built environment. The first objective was related to addressing current and future transportation needs. The first sub-objective was identifying a long-term funding source for transportation capital projects. This was really centered on Initiative 1A from last year. That initiative did not pass, and so the county is considering future options for funding transportation needs, but for now, this particular distinct sub-objective is no longer active. 1B, strengthening schedule coordination with partners. This is unchanged from prior updates. The replacement of their road event status system is in the IT steering committee queue and will be started hopefully sometime soon. And then 1C, enhancing regionalized transportation. The county's capacity to contribute to that was related to that initiative 1A. There is still work going on among engineering and road and bridge and others to continue to work with our municipal and state partners, but for the most part, this particular sub-objective is complete and operationalized as well. Any questions on that?
Thank you.
Looks like,
I looked over, Commissioner Stevens, your hand is raised.
Yeah, just there again, we are continuing this work, and we do a lot of regional transportation work with the Metropolitan Planning Organization. And there's also some efforts at CCI to maybe get a group together to address how we comprehensively look at transportation funding, because there's quite a few buckets, and there's different kinds of needs throughout the state, with, for example, bus staying funding versus road. So I think that there is, just for folks' knowledge, there is a lot of work that's happening statewide and regionally around how we fund our transportation systems, how we deal with some of the loss of state dollars, some of the federal requirements changing. So there again, this work does continue, and as you said, Josh, we're considering future options for our particular local funding.
Definitely good point. Thank you.
Thanks, Commissioner. Commissioner, did you want to add anything? Okay, thank you.
So objective 2 is related to developing a sustainable built environment. Similar to some prior objectives, a lot of these are now really complete with that initial work, kind of setting up the structures for this. And so the work is continuing in a lot of ways, but for the purpose of the strategic plan, they are complete. So that includes coordinating on air and water quality projects, advancing the electrification of buildings and transportation, and coordinating on a regional electric equipment rebate program. And then 2D, incentivizing regional water conservation. The Water Master Plan is being implemented along with plans related to drought, and so that work is ongoing. And then for 2E, developing a circular economy in our waste programs. There's a 45% solid waste diversion goal by this year, which is consistent with a state goal. And then here, I think next week at the SIPRS, which is Community Planning, Infrastructure, and Resources Service Area, there is a work session on solid waste capital projects and programming, and so you'll receive an additional update on these efforts at that.
Commissioner Stevens.
Yeah, just a question on 2C, the electric equipment rebate program. So is that the program through the RAC, or are there other programs that are giving rebates for food truck electrification?
I will confess I don't actually know. However, Environmental Health did let me know that they'll be doing an update either today, which they couldn't make, or a separate work session. And so there will be more information coming on that.
That's great. And I used an acronym, and Commissioner Cafalas it was the Regional Air Quality Council, I think. I want to say that there's a local a local food truck that did receive some dollars already. So I'll be interested to see that presentation.
And I'm sorry, I misspoke. The environmental health will either do an update at the next strategic plan work session, which will be in July, or at a separate work session. So,
Thank you, Josh.
Objective 3, which is developing a sustainable natural environment, the hazard mitigation plan update will be provided in September. The remaining sub-objectives will be updated at year end and reported on annually. If you remember at the January work session for this, our objective team leader, Megan Flanagan, walked through a number of data sets and reports. So that will be continuing on and really probably consider this complete once we get to next January, just because then it'll become kind of operationalized and with annual updates as well. So probably at the next strategic plan update, you'll see this being considered complete and operationalized.
Thank you, but we'll, even though it says it will be complete and operationalized, want to clarify your statement that we'll get an update with numbers and data and that
Yes.
won't, okay.
Yep.
I just want to clarify that. Thank you.
Yeah, and that can be done either at the strategic plan updates, which we have some ideas for how that might continue, but when this strategic plan is done, how will those updates continue, will be determined later. It could be part of the SIPR's work sessions or some other reporting method, So goal 4 is centered around county operations. The first objective is related to optimizing county processes and systems. The first sub-objective around artificial intelligence, this sub-objective is complete and operationalized. The policy around artificial intelligence use has been created. The training regime and tools for employees has been created. And so, again, this is one where the initial work is done and now it's ongoing. Also 1B, strengthening customer relationships. This one has been complete for a while. Working on the relationship between support services programs and customer departments. Sub-objective 1C around security. This one is close to complete as a lot of the policies and procedures for security-related issues have been considered by this committee. However, and I think we reported on this last time as well, there's currently a project ongoing to replace our access control system throughout the county. And so this group may help out with developing the procedures around access fob management, the little fobs we use to open our doors. So, once that equipment has all been replaced, then we'll need these new procedures really to finish that off.
I'd also like to give kudos to our threat assessment team. They've really done some training with our leadership team. The last department head meeting, they had half of the meeting to talk about what their role is, what they've done, how they can assist departments and offices across the county. And they have really kind of expanded their role and made themselves more well-known. So I appreciate their work as well. That's something extra they do as part of their job, and a big thank you to them.
Thanks for sharing that, Lorinda. Okay, let's move on. Thanks.
And the final sub-objective 1D is around creating community indicators and key performance measurements. If you remember from, I think, January, there was an update. The initial focus is on the environmental stewardship area. So collecting indicators and measures from that particular area across a variety of departments and offices. And so our objective team leader, Julie Elser, had hoped to provide a webpage display. However, it's not quite ready yet, and so perhaps at the next update. But she continues doing great work trying to create metrics and performance measures from all other offices as well and departments. So,
Great.
Any questions about that?
Any questions? Great. Great news.
Finally, I believe these last two objectives are complete. The first one, objective 2, collaborating and coordinating with partners and stakeholders, optimizing grant opportunities. We have a vendor now who we use to identify grant opportunities and help us apply for grants. They've been successful in a couple of areas, and so that project has really helped out a lot, I think. Co-location with community partners, we reported on this last time, that this particular objective is complete and also operationalized. updating the facilities master plan. This sub-objective has been complete for a while. This was just a little updating of the master plan itself. And then objective 3, which was around supporting and developing leadership. This objective is operationalized and complete as well, as reported on at prior work sessions. So any questions about goal 4?
Questions? I don't think so. Move quickly through them, but it's all good news.
Yeah. So as always, every quarter we work on updating the progress dashboards that are available on our website, and so I encourage people to look at that. A lot of great things have been done and are still ongoing. The next work session will be in July for the end of the second quarter. And so I kind of meant to address this at the beginning, but we're now thinking of perhaps having these updates after the second and fourth quarters as opposed to every quarter, just because you see so many of these objectives are now complete. There's not as many timely updates to provide. And so if you're okay with that, we'll do the next work session in July as normal, but then after that, do it in January of 2027.
You must have been reading my mind. So colleagues, any questions? I was just thinking about that question. Any questions, comments? Because you're at the end here, correct? So any comments, questions, Commissioner Stevens?
Yeah, I agree with, maybe waiting for that next update after July to the beginning of January, just because, I'm sure if there's something that's really critical or crucial or where you need input from us, you'll share it. But otherwise, a lot of things are being implemented, and it's better to have, kind of save those reports and not necessarily have less to report. So I think that's great. I think this is all really great information. I'm pretty excited that we're doing as well as we are with all these goals and objectives. So yeah, thanks for the presentation, and look forward to seeing you in July.
Cool.
Commissioner Kafalis.
Yes. Thank you. I agree that it makes sense to go from 4 times a year to twice a year. One thing I would respectfully ask that when you do the next one in January, if it's possible to do it before January 12th.
Okay.
So that I can be in on it.
We can try.
You can try,
We'll do that.
whatever makes sense, but, and otherwise, great work on the strategic plan. I think to build off of what everyone has said about the sub-objective, et cetera, is complete and operationalized. I mean, that work doesn't necessarily stop. It's just been sort of either inculcated into the organization, it's part of our normal procedures, or, we're working closely with community partners to continue that work. So that's an important point that my colleagues have made, and I just wanted to reinforce that point. But thank you, Josh, for shepherding a lot of this work, and you continue to do extraordinary things, and so does Julie and Emily.
Appreciate the presentation, appreciate everyone being here, and I want to just thank you, Josh, for your leadership and stewardship of this. What I was thinking in my brain is when you had mentioned going to maybe just the 2 updates, is it seemed like there was a lot that was operationalized, and so maybe we didn't need to have as frequent updates, since a lot of it is kind of accomplished. I wouldn't say accomplished, but met the objectives that we wanted to do. And so I was wondering if that was probably something we were looking at, just to, honor everyone's time and especially those who do this work, because a lot of it's above and beyond duties as assigned, and I wanted to kind of take that into note. I agree about, build on the comments about operationalized, and I just wanted to add, and maybe you can clarify me if I make a statement that's not quite true, Londa, is when it's operationalized, doesn't mean that it's business as usual. It will still continue, I'm sure, our staff to innovate or to adapt as we move forward with different conditions and laws or things or resources change, where a lot of this will be, I wouldn't say tweaked, but adaptive to the conditions, and I'm sure we'll get some updates with that as we move along. My other question is, we have a lot of partners, and we had a lot of folks at the beginning of this plan, and really the plan should be probably looking, kind of coming to fruition before 2028, because we don't, we kind of plan to get this done, then we'd start working on the next one. And so we started off with a community meeting or a community convening, and I'm wondering, as this all comes together, if we were looking or thinking about how we, like especially like the mile markers and some of these other things, how we do appreciation or thankful for all our partners and for the staff, and maybe show the progress, and maybe even from the photos from that first meeting and through, and just maybe give everyone a chance to recognize how much work they've done and how much they've been a part of something pretty big and pretty amazing how things have moved. I mean, I'm just still, fingers knock on wood, it just feels like things are really progressing at a very fast clip, but also very, in an organic, collaborative partnership way, and I really am celebrating that inside. It feels like there is a lot of expansion of our network or our partnerships and out into the community, and getting that back, that the community wants to be engaged. So I'm wondering about that piece. I don't know if you or Lorinda want to comment on that, or maybe it's already in the works.
Yeah, so I can start. As far as the county employees who participate in the strategic plan, we have given out awards of Nectar Points, as a thank you, and especially to the objective team leaders. So we'll continue to do that, whether their objectives are ongoing or not. In a lot of cases, like you said, those things are now part of their daily work lives, and so we want to recognize that. I believe we have communicated with the folks who participated in the community forum when we put this together to give them an update. And so now kind of waiting on the progress of Goal 1, Objective 1 about the mile markers to continue doing that. And it was a great segue to that last bullet, initial work beginning on the next version of the strategic plan, because just like with the last version, there's a lot of lessons that have been learned. And so one thing I think, when we put this one together, we were surprised by the lack of knowledge of what the county is already working on. And so what I would like to do, especially thought of this during the consideration of all the places where we're a convener, is really inventory all those things. We've started to do it with this plan a little bit, but provide that information to the community first, and to the stakeholders, that we think will be involving first, to say, here's everything the county is working on, so that when we gather them up together to help create the next plan, they'll hopefully already know that. And also trying to work with a broader selection of groups as well, going to them and saying, here's what's in process and what do you identify, as opposed to, bringing everyone together one shot. So that work, honestly, I'd like to start maybe next year, as opposed to, in the final year, you give it even a longer time. So, which is hard to believe that in July we'll be halfway through this 5-year period. So, yeah, all great ideas, and we're working on all that. So
Wonderful. I just, I think also it's just always great for folks to look back and feel a sense of accomplishment for all this, because it has been, a lot of above and beyond, but also they're adding things onto, their, as you said, daily tasks. So this is really important. Again, great job. I appreciate the updates, and also it's great for the public to see that there's a strategic plan, and we're really, I think the big thing for me is we're innovating and also reaching out to strengthen our partnerships and also nurture those, especially with the P card and other things. And there's a lot of overlap and overlay with a lot of important pillars in the community, and I think that's something really important to highlight. So I can't do this work alone, and I think this plan is definitely a reflection of that, and so I really am thankful for that. I'm going to leave the last word to Lorinda. Would you like to add anything, Lorinda?
I think I'll add, the next strategic plan will look different from this one, not just because it looks forward 5 years, but because when this was being formulated, we had a couple of major initiatives going on. We had the Climate Smart initiative, we had the CHIP, which was really a big community engagement piece as this was getting started. And the idea that we didn't want to overload staff with too many new things all at one time. That was sort of a perfect storm of good planning. And so a lot of those got incorporated into this. The next one is likely to be more targeted, maybe fewer goals, fewer objectives, but maybe larger outcomes planned. So we've been talking a lot about how do we engage more community members early, get a lot of feedback early on. And Josh came up with the idea of let's make sure they know what we're doing so we can either build on that or they realize we're doing that work and they can focus on a different need that we could take up for next time. So, Josh, thank you for your forward thinking. I think we've made a lot of really good progress. There's still work to be done, and we'll just keep plowing away at it.
Well, Commissioner, did you raise your hand again? Oh, well, I want to just say, once again, we're starting off our week on a Monday, just like last preceding weeks, with some good news. And I really appreciate that. And thank you all for joining us. At 11:15, we are adjourned. Have a great day.